Hello, welcome to Dr.G Pediatrics. I am Dr. G, board certified pediatrician. Most importantly, I am a mama, so I like to talk about topics pertaining to pediatrics, but also from a parent standpoint point of view. So today we're going to talk about exclusive pumping, and it is near and dear to my heart. And I just want to provide some tips for moms who are thinking about exclusive pumping or currently in the woes of exclusive pumping. So if you think this would be helpful, stay tuned. All right, so one of the main things that I will say is, can I exclusively pump? Yes, you can. You most certainly can. I remember, I'm just gonna give a quick anecdote. I know you wanna get to the hacks, you wanna get to the tips on exclusive pumping, but I remember being with my first daughter, Layla, and breastfeeding the first couple of weeks, and she wasn't gaining weight, and she had issues latching, and I was like, we are gonna do this. We are gonna do this. And I ended up having to pump for weight gain purposes, and so it became a thing. And I was in residency and I didn't even realize that exclusive pumping was an option. It was always you breastfeed or you get formula. So when my eyes were opened to exclusive pumping, it was a lifesaver. It was a lifesaver for me because it allowed me to still provide what I wanted to provide for my girls. Breastfeeding and breast milk was super important to me, and I wanted to be able to do that. And it just was not happening the way I intended, but in comes exclusive pumping, and I did it with both of my girls, and it was successful. So, sorry for that rant. I felt like, there are moms that want to know that, Okay, so tips, hacks that I found helpful with exclusive pumping. So one of the biggest things that I will say is it's supply and demand. So you want to be pumping the way you would theoretically be breastfeeding or nursing a baby that was directly to your breast. So every 2 to 3 hours, a baby would feed. Well, in the first 12 weeks of life, that is when your milk supplies are actually being generating and you're kind of establishing that imprint. So the first 12 weeks of life, you definitely want to mimic what a baby would be doing at your breast, which means pumping every 3 to 4 hours, which averages to about 8 to 12 pumps a day. Can you do it? Yes, you can. So that's what I did. The first couple of 12 weeks of life, it was, pumping, simulating what a breastfeeding would be. So that's super important because that is going to help establish your milk supply. Okay, and so that's about pumping for 15 to 20 minutes, both sides combined. And that's kind of ideal time for a pumping session. So supply and demand. The more you pump, that is going to help establish that milk supply, especially within the first 12 weeks of life. Okay, so with that being said, another hack or something that I just found very helpful was the middle of the night pumps. Just when, they look at studies of milk production in women, those middle of the night feeds or pumps, you end up getting more output during those feeds. So I had a schedule, I set an alarm, and I was waking up at 2 o'clock in the morning, and then again at 5 o'clock in the morning, just based off of my schedule to get those middle of the night pumps in. And this was the first 12 weeks. I mean, obviously, if I was nursing a baby, I would be doing the same thing. I would be getting up in the middle of the night and putting that baby to breast and breastfeeding and nursing. So it's going to be similar, but it's doable. And it helped yield and establish that milk supply. That, I think, helped me more with my second daughter, with Layla. We were all in survival mode, okay? Okay, but so the middle of the night pump is super, super, super beneficial. So that's something that you definitely want to do, especially the first 12 weeks of life. A hack that I found super helpful was getting a mini cooler and putting ice in it and keeping it by my bedside. So when I did my pump and I disattached myself from that pump, I just set that milk on the ice in the cooler. I didn't have to get up out the bed. I could try to regain whatever sleep I could regain. And then I didn't have to worry about taking it to the fridge. Yes, breast milk, freshly pumped breast milk can stay at room temperature for about 4 to 5 hours. But I just didn't want to take that chance of something happening, me sleeping through longer than 4 hours at that time of year is probably laughable now, but I just didn't want that milk to go bad. Not after I had woken up in the middle of the night to pump. So keeping a little mini cooler by the bed just to put that breast milk there and just try to roll back to sleep, for me, it changed the game. It changed the game. So that would be super, super helpful that I would recommend. So another hack for me that I found helpful when I was exclusively pumping with my daughters was having an extra backup set of the pump. So the horns are called phalanges, and I had a just kind of rotation where I would use one, wash one. But something that I didn't realize when I first started this, I was washing after every use and sterilizing and doing all of that. But I realized that you can actually just put the pump parts in a Ziploc bag and actually put it in the refrigerator, and that will kind of keep any bacteria or germs from growing, and then you can just take it out of the refrigerator and use it. And then, of course, you would have your other set already washed and ready, and then you would just, at the end of the day, clean that set, which to me was a game changer. It, shortened time of washing pump parts, because that's like a dreaded thing. Anybody who exclusively pumps, it's like, oh, she's always washing pumps. You're always attached to a pump. So keeping your pump parts in a Ziploc bag in the refrigerator throughout the day in between pumps, definitely time-saving hack. With that being said, is when you exclusively pump, your nipples can definitely be traumatized, and you can have blisters, milk blebs that can appear on your nipples. So a lot of the time that happens just for that ongoing friction that is created when you are pumping. So another hack that I found about was adding a little bit of a lubricant to the inside of the horns or the phalanges prior to pumping. That would be safe for the baby to consume. So for me, I use extra virgin olive oil. Coconut oil can also be used, and it's a minimal amount that actually gets into the breast milk, so it's not causing any harm. And extra virgin olive oil and coconut oil are not harmful to the baby. I didn't do coconut oil simply because coconut can be considered an allergen, and I just wanted to, I did not want to add any other issues to my plate. So I chose extra virgin olive oil because that is not a very highly allergenic food. So just taking the horn and just taking a couple of drops and just lining the inside of the horn before I put them to pump definitely helped ease some of that pain, especially when I had experienced like milk blebs or blisters right along the nipple. Super helpful. What else do I want to talk about? Okay, so I know you guys are like, okay, what do you do to increase your milk supply, Dr. G? You're doing all this other talking. So there's no magic. Every woman is different. A normal pumping session for an average amount is about 2 ounces combined. Okay, so I would be super discouraged when I would see moms that had like a pumping session, and like every time they were getting like 6 to 8 ounces like per pumping session. I was like, how, Sway? How? I will say at one point I would get I would have a few pumps during the day where I would like really rock out and like make 6 to 7 ounces. I was on cloud 9 when I did, but that didn't happen all the time. Okay. So galactogogues are the fancy terms for things that you can take that's going to help promote or boost your breast milk production. There are studies that show some increase with certain agents versus others. I am not being paid to promote anything. I was just telling you from my heart what I did. I used fenugreek. I thought fenugreek was great. It was a herbal supplement. It was a vitamin that I could take. There had not been a lot of studies that showed harm to the newborns. There were some saying that sometimes it can cause some stomach, like, a disruption or upset in babies, but nothing major. So that for me as a pediatrician, that was of course one of the ones I'm like, I don't want to take anything that's going to potentially harm my baby. So fenugreek I tried. I used fenugreek. I felt it helped. I also used brewer's yeast supplements. This is for my first daughter. I used fenugreek, brewer's yeast supplements for Layla. That was about it. I was in residency, again, trying to survive life. And we did not have a lot of extra money flowing at that time in residency to spend on like a lot of fancy teas and cookies and things like that. So I just did what I could. So then with Gracie, I was in a totally different financial situation. So I did. I was like, I'm going to try these capsules. There were some brands, some cookies. There were oatmeal cookies that were supposed to have galactogogues in them. I tried that. Did it help? I don't know. But again, it wasn't harmful to the baby, and it gave me some type of peace of mind that I was doing anything. So I'm not promoting any of these things, especially if you're not in a position to purchase any of these things. The more important thing is going to be really increasing your pumps. That is what's really going to help supply. Every woman is different. So every woman is not going to produce the same amount of milk for their baby, and every baby is not going to need the same volume of milk per feed. So don't let that stress you. Don't get consumed with, people that you see are making like tons of ounces per feed, because that is not necessarily realistic for everyone, and it is okay. So with that being said, I did drink coconut water, lots of water before and after pumps, Gatorade, and I did all these things to make sure that I was staying hydrated, because you are depleting yourself of a lot of fluid with all those pumps. And so definitely water consumption, increasing your water consumption can definitely increase your milk supply. So anything that is going to help you retain water. So Gatorade, has electrolytes. It helps you retain water. Coconut water is good. It's not harmful. Straight old H2O is also great. That is something that can definitely help boost your milk supply. And then one of the main things that I say will help you boost your milk supply is, the answer. Don't stress. Don't stress. Yes, I know. There was like the crickets for me just a while ago, because we know that. We know we shouldn't be stressing, but it's hard. But stress does impact your milk production. Stress raises your stress hormones like cortisol, and all of that can impact your milk supply. And we don't need that. We don't have time for that, right? So I hope you found these tips useful. There are a lot of other exclusive pumping discussions that we will have. This was just a quick one that I wanted to do because I'm just so passionate about exclusive pumping and it being an alternative option for moms that, again, when I was with my first daughter, who's now 9, I didn't really see that as an option that was really promoted. And even with my patients, I'll have moms, and I've talked through moms, helping them with exclusive pumping. It may not be for you. That's totally okay. I'm not saying you need to do that, but it is an option. It's a wonderful option and it's doable. So I hope you found this helpful. If you did, please subscribe or share or let me know your thoughts. As always, stay awesome and have a great day. Bye.